Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hello, my name is Alfred Peraza. I am a physical therapist at Dignity Health, Yavapai Regional Medical Center. I have been with this organization for nearly 25 years and a physical therapist for nearly 31 years. So today, I'd like to discuss and talk about a matter of balance, with our goals being defining what is balance, what body systems help maintain our balance system, and how to learn various exercises to improve our balance. To define balance, balance is the ability to keep the center of your gravity over your base of support. If you are unable to do this, then you have a greater likelihood of falling. The CDC estimates that 1 in 3 seniors are expected to fall each and every year. That number doubles each decade of life. So practically speaking, balance is the ability to keep yourself from falling and hitting and striking the floor, resulting in an injury. There are essentially 3 systems that we utilize to help with our balance system. We utilize our vision, we use our inner ear, or often known as our vestibular system. We also utilize our somatosensory system, which I will discuss in more detail on the next slide, or future slide. Our visual system allows us to measure distances for depth perception, to see objects. As our vision declines, then we can also have a greater risk of falling. Again, if we are stepping over a threshold, stepping over a curb, and if we are unable to see our obstacles, then we are at greater risk of having a trip and a fall injury. And we must all remember that as we all age, our various systems can and tend to decline, including our vision. Often, as our vision declines, we have to rely more on our somatosensory and our vestibular system, or our inner ear, to help improve our balance and lessen our risk of falls. With the inner ear, our inner ear helps to interpret our head in space, where our balance point is. We have structures in the inner ear that are called the semicircular canals. They help maintain our balance with head movement. It could be rotational movements as we move our head left and right, up and down, or even diagonal movements. Also, our inner ear provides us information as we move in a linear fashion, as you go in a car, going up and down the elevator. All these movements of our head and body are detected by our inner ear. So it's very important that we keep those vestibular systems in the inner ear as functional as possible. Often there's problems that we see in the therapy clinic when there's dysfunction or something's not working right in the inner ear. There are crystals in the inner ear that can often get dislodged. And as those crystals get dislodged, that becomes an impairment and affects our balance and cause dizziness. That is one of the most common causes of vertigo that we see in the clinic. It is called Bppv, and it is often treated by a certain technique that we in the physical therapy clinic often perform. Our somatosensory is our body and sensory system. We rely often on our muscles, our ligaments, and joint receptors for our body to provide our brain and our nervous system with information as to where we are in space. As we lose sensation in certain diseases or processes such as peripheral neuropathy, we may lose sensation in our feet. So if we lose sensation in our feet, we may put more weight on our heels where we have more sensation, and that could affect our balance. Sometimes due to a small stroke or TIA or a large stroke, that can affect the strength in one side of the body. And that can also affect our balance system as well. So it's very important to understand that our body does provide our brain and our whole being with our balance system. And it's very important to maintain and keep our somatosensory in an optimal condition to prevent a fall. Our somatosensory system also, again, as we reach and move and try to reach for an obstacle, it could be in the kitchen, it could be reaching into the oven, it could be reaching into the dryer. As we change and reach, change positions of our body has to make accommodations in that center of mass, and we have to respond appropriately. So again, somatosensory is very important that to help keep us safe. There are various exercises that are non-traditional balance exercises that we can do every day to help maintain our balance. Non-traditional activities can just simply be out gardening. It could be out playing pickleball. It could be ping pong, tennis. In the therapy clinic, I tell my patients often that life is movement. It's very important that we move to keep all our various systems in optimal condition. What can happen is that if we stop moving, we can atrophy, our muscles lessen in their size, our nervous system is unable to respond properly to changes in balance and movements, and we can become less risk of fall. So many activities, joined outdoors, playing sports, playing with the kids are very important exercises and non-traditional exercises that we can do to help with our balance system. More traditional exercises could be participating with an adult fitness program, your physical therapy programs, swimming, weightlifting, walking. Walking is very important to maintain our body system. I often speak to my patients and inform them that walking is very important, that we walk at an appropriate speed, that we pick up our feet, that we swing our arms, that we move our head, we move our whole body. Often in the clinic, we assess the quality and speed of walking because there's also great association of falling if we tend to walk at too slow of a speed. Normal walking speed is approximately 1.1 meter per second, and it is also considered a vital sign, such as blood pressure, heart rate. Walking speed is just as almost important as those other vital signs. As our walking speed declines, we tend to have an increase in falls. Research shows that if we walk too slow, it can predict hospitalizations and even discharge to a skilled nursing facility if our walking speed is too slow. Balance exercises are very important and can help to improve the bias of our inner ear and our somatosensory. Movement of the head and the body are very important. They can be various degrees of exercises that we can perform. So the ways we can perform our various exercises are by varying the surfaces in which we exercise. We could use a firm floor. Generally in physical therapy, we do have a progression with exercises. Some individuals will have to begin in a sitting level where they are more stable, progressing to standing on a firm surface. Then we can incorporate dynamic balance in which we're moving the body. We can move, you can use various tools to improve our body, our balance and our body movements. I brought a few items today to kind of demonstrate how various tools can be used to improve our balance. Again, every individual has different levels of ability. So a patient may need to start on a firm surface, but they may be able to progress to the use of a foam cushion. So an exercise activity such as simply stepping on a cushion and stepping off, having an individual picking up their feet and making sure they stabilize before they take their step down could be a very helpful exercises for balance. This is called a smart hurdle. The smart hurdle is utilized in the clinic often for individuals who lack hip motion, ankle motion, and to improve lower stability, simply by picking up your foot, heel striking, leaning on a front foot, picking up your foot, and alternating right foot and left foot, and maintaining your balance. Some individuals, this may be too much exercise and may not have the stability needed to, or the stability to perform this particular exercise. Foams are also used. So a higher level activity can be having somebody step on a foam and work on static balance, overhead balance, head movements. Again, starting slow and moving faster and faster is a progression of your balance. So with the Dynadisc, this can be utilized for a single leg balance exercise, shifting weight, maintaining core, balance, and stability, somatosensory. Other devices can be utilized as well to help your safety and balance. Trekking poles increase your base of support. So if you're walking and you feel a little unsafe walking the heels in the Prescott area, trekking poles are very helpful to stabilize, increase your base of support, and make you a safer ambulator and exercise safer. Everybody's abilities vary. Again, some people may not need any assistive device. Some people may need a single point cane. Some individuals may need a front wheel walker. Everybody has different levels of abilities. It's the physical therapist who assists you in determining what is the most recommended device for you to ambulate and be safe when exercising in the community. So when discussing more about improving your somatosensory, as I discussed, various devices can be utilized to improve that communication between your foot, ankle, hips, and knees all the way to the brain. Your body is always providing you with information. So the better you can improve the receptors in the various joints, such as your ankle and knee, the better your balance will be. Also, muscle strength is very important. One of the things that occur as we all age is that our muscle mass can decline. As our muscle mass declines, then we have less strength and stability. So exercise will help strengthen up your muscles and provide greater stability at the various joints that hold us up. I always inform my patients that gravity wants to do everything it can to put you on the floor. What keeps us up and vertical are our muscles, bones, our somatosensory, our vision. It's important that we keep all these systems at an optimal function. So it's very important that as we exercise, I feel it's important that we all do exercises in which we feel we do activities that we enjoy doing. It may be walking up Glassford Hill, Thumb Butte, the many trails that we have in the Prescott area. Some people prefer to be inside and use a treadmill. Some individuals utilize technology. There's virtual reality. There's other games that help your balance. The important thing is to find something you enjoy and stay active and keep your various body systems at peak level of function. I'd like to thank you for being here for this presentation, and I'm available for any questions. We are never too old to improve our balance. We have the ability to strengthen muscles throughout our whole life. We have the ability to stay active. And as we do age, it's more and more important that we do keep an active lifestyle. Also, that's important is that as we exercise to improve our balance, we also want to keep our bones very strong. So the more weight-bearing exercise we do, we keep our bones strong, we keep our balance systems as efficient working, our vestibular system. Life is movement. So it's very important that we all exercise and that throughout our lifetime, exercise is a benefit for all of us. Getting up from the floor can be a challenging task. Again, CDC estimates that if we were to put 100 seniors on the floor, nearly half of the individuals on the floor would be unable to get up. So getting up from the floor requires flexibility of our joints and our muscles. It requires strength. So every individual has different levels of abilities to get up from the floor. Now, because it varies, it's important that individuals speak with their healthcare provider, their physician, or see a physical therapist to see what is the best method to get up from the floor. Some people have the ability to crawl on their hands and knees and move from the floor level onto a chair and then to a standing position. Some people, because if they do not have strong lower extremities, they might rely on their upper arms and may have to scoot themselves up from one level to another by backing up and then standing up. One way to get up from the floor could be simply to roll over to your side, get onto all fours, place your hands and elbows on a steady chair. With your stronger leg, you can place it under your body and push up to stand. That is one way to raise yourself up from the floor should you fall. After a knee replacement, an individual may have only about 120 degrees of knee bending in their knee replacement. So that can limit the amount of ability to be on all fours and push yourself up. It's important that when you go through a joint replacement, that you ask your physical therapist to practice getting up from the floor. Again, due to different physical abilities of individuals, the various techniques may be relied upon. Some individuals may have to utilize their non-surgical lower extremity to get up from the floor, or have to find different strategies such as backing up and scooting themselves up from a lower surface up to a higher surface. So it's very important that getting up from the floor is practice, you feel confident, and that you stay active. In the clinic, I inform my patients that many individuals that we see in the therapy clinic, once they are afraid of falling, they can become less active. Then what happens is once you become less active, then you actually become a greater risk of falling because you begin to lose muscle strength, you do not challenge your vestibular system, and again, your somatosensory system can be impaired due to a lack of activity. Thank you for joining us with this Healthy Conversations topic. We have additional topics available online if you are interested.